Thank you very much. Hi, everyone. I've got a lot to cover today with just the announcement that was made about an hour ago about reopenings. So I'm just going to begin with the cases. The case went up by 2,400 today in Ontario. Again, a bit low, a bit higher than what we've had over the last couple of days. But overall, week to week, we're at about 20% or so decrease week to week. Again, driven by Toronto and Ontario. Ottawa is at the 90 range. So and they too are going down. I'm going to just go over some of our numbers. Thought I had them here. Hold on. Stop sharing screen. Sorry about that. I'm just gonna get the numbers. I had them before. Anyway, we had a quite low numbers today. I was pleasantly surprised when I saw that. We went up, I think, by a total of 6 cases in the health unit area. I'm just going to make sure I got it. There we go. We're now at, again, looking at the rolling average. It really sort of brings us down now. Right now, we are technically in the orange range, as you can see here. And in terms of our changes, we've added 6, and 1 in Cornwall, 1 in SDNG, and 4 in Prescott Russell. Again, among the lowest that we've had, so it's very good as we move forward into that. We're approaching the 100,000 mark today. We're gonna, by the end of the week, we'll be close to the mid-90s in terms of vaccination, and I'll talk a bit about that later. But I just wanted to, again, go over what was announced today, just to make it clear to everybody that there were basically 2 announcements today. The first announcement was the fact that we're still going to be under that June 2nd stay-at-home order. However, effective on Saturday morning, this Saturday morning, there will be outdoor amenities that will be allowed to open. And I want to be clear because we've had a lot of questions about that. So marinas, boating clubs, and other organizations can open up this weekend, and there are some provisions that clubhouses, restaurants, and pools and all indoor amenities must be closed, except for washroom access and so on. And again, and then recreational amenities can open, again, following protocols. And again, the gathering limit has been increased now to 5 outdoors only, and that could be from different households. I just want to clarify that. So that includes parks and recreational activities, baseball diamonds, batting cages, soccer, football, and sports fields, tennis platforms, basketball courts, BMX parks, skate parks, golf courses and driving ranges, frisbee golf locations, cycling tracks and bike trails, horse riding facilities, shooting ranges, well, winter sports anyway, playgrounds, which were open already, portions of parks or recreational areas containing outdoor fitness equipment, archery ranges, and then boat and watercraft launches. And again, this has been a question that we've had. So now the fact that boat and watercraft launches are now included means that they were closed before. We were asking that all the time, but anyway, it's clear that as of this weekend, boat and watercraft launches will be open. Lawn games, lawn bowling, and so on. Again, they must have certain conditions, 2 meters apart, masking where appropriate. Indoor locker rooms, those things should be closed, and team sports are not allowed at this point. And again, this is really meant for this coming weekend up until we go into step 2 phase, which is then going to be what's called sort of the reopening after June 2nd. So what they said today was something that I've been kind of hinting to everybody in terms of the way we see a reopening. Again, thinking about the date of June 14th, premised upon obviously numbers based on case numbers and case rates, but also step one would be 60% of adults vaccinated with one dose. Step two would be 70% of adults vaccinated with one dose and 20% two doses. And step three would be 70 to 80% of adults with 25 with first dose and 25% with second dose. Again, these are also going to be coupled with case rates and so on. And however, their approximation is about June 14th, where that will begin. It may start a bit earlier depending on our numbers. I believe that in our area, we will be at 60% very shortly. As a matter of fact, we'll be at 65% by the end of this month. And so I think that that'll vary. So, however, they're giving us approximate timelines. And step one will include really a couple of things. I don't have the full regulations here, but what we're saying is there'll be outdoor gatherings of 10 people, maximum 4 people per table at patios or restaurants can open, and non-essential businesses can open with 15% capacity, low capacity. Step two, which will likely be 3 weeks later, that's what they're saying, 3 weeks later, further expansion of those things, which includes gatherings of 25 or more, outdoors. It will be outdoor sports and leagues, personal care services where face coverings can be worn with capacity limits, as well as indoor religious rites and ceremonies with 15% capacity. And then and others, there'll be other things. I presume water parks are in there, pools are in there as well in step two, obviously. And then step three will be a more expansion into indoor settings with restrictions, including larger number of people and so on, and indoor recreational fitness and other activities, indoor dining, museums, galleries, casinos, and with, of course, capacity limits. And then, as we move forward and get more people vaccinated, particularly the second dose, we're going to be seeing, a substantial removal of public health restrictions and, of course, masking and those type of things as we get second dosages and so on. So I think that's excellent news. Again, caution that we ensure that we are for sure following public health measures. This weekend, I know the Premier cautioned about an hour ago that yes, we're all tired, but please, go out and do it safely. If you're going to go on a boat, do it with your family only. Don't mingle with other people and so on, because it's a close quarters. Again, if you're going to go outdoors and go to a park or whatever, you can gather with 5 people, even outside your household. But again, maintain physical distancing and so on, masking when you can. All these things need to be continued so we can continue on a downward trend as we go into approach the first week of January and second week of January, at which point in time there'll be a more precise decision as to the exact date of going into this step one, which appears to be a provincial and not a regional approach at this point. And you also note that this is not the color-coded approach either. Now, in terms of vaccinations, I want to go back to my slide, to my presentation here, my slide, where we, right now we're at 91,773. Actually, that excludes today's numbers, which will be another 2,000 or so. So we'll be in the 93 range. And then tomorrow we'll have another couple of thousand. So by next week, we'll be in the 100,000 range. I just wanted to say a few things about vaccines. Number one, in terms of a vaccine summary, you can see it here. We've had some questions about the 100% here. I will explain what it is. The numbers that we're basing them on are based on the 2017 census. And so the population has changed. So we likely had more people than the census than the denominator. And that's why, some health units have 103%, 105%. It's because those numbers vary. If we look at some of the analysis that the ministry has, as a matter of fact, we're probably in these both areas here in the 80 and 70 age group, we're 94 to 95%, which is excellent. So again, that's why people were questioning about 100%. it's more of a statistical issue. 84% of 60 to 69, and then it goes down. But these numbers are going to go up quite quickly as we move forward. So I think that's very, very encouraging. And then I just want to give you a bit of an update of where we are with our vaccines clinics right now. As I said, between this moving forward and to the end of the month, we'll have 23,000 positions, 23,000 all the way to the first week, actually the last week of May, which is the first week of June. It overlaps. We have 23,000 spots, which are almost all taken. However, we now added for the week of between June 7th and June 26th, we've added another 27,800 positions. So between now and the 26th of June, we will have about 50,800 spots there. Presuming we're only counting those and we're not counting what's in the pharmacies and what the primary care physicians will be giving, what our hospitals will be giving, we will be, if you look at 50,000 plus around the 90,000 where we're at now, we'll be at over 140,000. And if you look at 140,000 over our adult population, we'll be at 83% at that time. And that will be around, like I said, the third week of June. So we'll be certainly be reaching 60, 70% way before that. And if we calculate on our overall population that's eligible for vaccination, 12 and above, that's about 180,000, we'll be at 78% at that time. So you could see that we're moving very, very well. Again, I'll be anxious at that point in time to start doing second doses, because again, the second doses are the ones that are going to be the percentage of second doses are the ones that are going to really accelerate moving forward. We don't have any more updates on AstraZeneca, but I can tell you that our pharmacies, and I just got a revised version the other day. I had counted 44, but the official count is 41 pharmacies in our area that are going to be getting Moderna and/or Pfizer starting this week. And so again, as they go on, they'll be put on our website moving forward. Donc, bonjour tout le monde. On va commencer avec les statistiques ontariennes et je vais aussi faire des résumés de nouveaux annonces qui étaient faites aujourd'hui vis-à-vis cette fin de semaine et l'ouverture après le 2 juin. En effet, on a augmenté de 2400 cas depuis le lendemain. C'était un peu plus haut que la moyenne qu'on avait dans les derniers quelques jours, mais encore, semaine par semaine, c'est 20% moins au niveau de la tendance hebdomadienne que nous avons. Toujours, c'est Toronto et l'entour de Toronto qui mène. On avait 92 cas à Ottawa. Chez nous, en effet, aujourd'hui, on a ajouté seulement 6 cas depuis hier. Donc, ça, je pense que c'est un chiffre bas, et puis j'aime ça. On voit ici qu'on a ajouté 6 en total. Il y a une à Cornwall, une à SDNG et 4 à Prescott Russell. Et on voit ici que finalement, au niveau de la moyenne mobile, on voit que ça commence à diminuer. Puis on est rendu vraiment dans l'orange, 38,9 au niveau de la moyenne que nous avons au niveau du Bureau de santé de l'Est Ontario. Et à mon avis, ça, c'est des très bonnes nouvelles pour nous. Donc, comme vous avez bien sûr entendu parler, que nous avons fait 2 annonces aujourd'hui. En effet, une annonce était plutôt des changements au niveau j'ai perdu. Des installations récréatives à l'extérieur, en effet, qui pourront être ouvertes dès le 22 mai, soit cet samedi à minuit. Donc, on perd les marinas, les clubs nautiques et les autres organisations des parcs-adhères, etc., qui pourront être ouverts. Par contre, les restaurants, les salles de bain, les salles de changement devraient être toutes fermées. Et aussi, bien sûr, on a une liste des installations récréatives qui vont ouvrir aussi, toujours à l'extérieur et toujours avec les limites. Il faut dire aussi que la limite de rassemblement était été maintenant mis à 5 à l'extérieur et ceci peut comprendre des personnes dehors de votre foyer. Ça, c'est très important, mais limite de 5 personnes avec les précautions, etc. Et aussi, les installations récréatives de plein air peuvent ouvrir avec des conditions conformes, en effet, au niveau des distances physiques, etc. Donc, on perd les parcs et aires récréatifs, terrains de baseball, les cages de frappeurs, les terrains de soccer, football, etc., les terrains de tennis, terrains de basketball, les parcs de BMX. On parle aussi les terrains de golf, les placements de disques de golf, les pistes sentiers cyclables, les installations d'équitation, les chambres de tir et aussi on voit ici les terrains de jeu, en effet. Et nous voyons aussi finalement que les rampes de mise à l'eau pour le bateau sont ouvertes dès samedi. Donc, on a une liste de l'extérieur et en effet, il faut faire attention qu'il y a les limites dans ça. Les sports d'équipe ne sont pas permis. C'est les limites de 5 personnes. On ne peut pas rentrer dans le vestiaire, etc. Tout ça. Donc, ça, c'est en vigueur dès samedi prochain. Soit le 22 mai. Et il faut faire attention aussi qu'on respecte les normes autrement parce que encore, on a l'ordre de rester chez nous. On est encore avec les confinements présents que nous avons qui va expirer le 2 juin. Mais d'ici là, c'est sûr et certain qu'on devrait vraiment faire attention. Je sais qu'on va avoir une fin de semaine longue cette semaine. Je pense que les gens pourront aller prendre un break. On comprend qu'ils sont fatigués, mais un peu plus de patience parce que dès le commencement de juin, on va avoir à ce moment-là vraiment le réouverture officielle du province d'Ontario avec vraiment les étapes basées non seulement sur le taux des cas, mais sur le taux de pourcentage de vaccination qui va bien, en effet. La première étape va être vraiment, probablement, ça va commencer mi-juin. On n'est pas sûr, ça peut aller plus tôt, dépendamment des chiffres. Mais ceci, on va voir des rassemblements à l'extérieur de 10 personnes maximum. On pourrait avoir des restaurants avec les patios à l'extérieur avec 4 personnes qui vont dîner à la fois et les magasins non essentiels pourront ouvrir avec 15 de capacité. Deuxième étape, ça va être 3 semaines après à peu près. À ce moment-là, on va avoir des rassemblements à l'extérieur de 25 personnes, ouverture, les ligues de sport, les barbiers, etc., qui pourront ouvrir à ce moment-là. Les coiffeurs, tout ça, personal service settings, avec aussi le pourcentage à 15 des églises, des choses comme ça. Étape 3, 3 semaines après, ceci, si tout va bien, va aller fin juin à peu près. Parce qu'on compte, si on commence le 14 juin, en tout cas, 3 semaines, 3 semaines, 3 semaines, ça va nous rendre vers la dernière semaine de juillet. Encore, c'est flexible au niveau des dates, mais à ce moment-là, on va procéder avec l'ouverture des événements à l'intérieur. En effet, aussi, il va y avoir les limites de l'intérieur, les restaurants à l'intérieur, les gymnases, les espaces récréatifs, sportifs, etc., les bibliothèques, etc., qui vont ouvrir. Donc, ça, c'est des bonnes choses. Et ceci, ça va être réévalué à chaque 21 jours. Et la première étape, non seulement ça va dépendre au niveau des cas quotidiens, etc., ça va aussi aller au pourcentage des vaccins. Et 60 des adultes vaccinés une dose, c'est la première étape. On va l'avoir dans quelques semaines ici, facilement. Étape 2, ça va encore avec les chiffres au niveau de l'hospitalisation, etc. 70 des personnes avec une dose et 20 deuxième dose. Et troisième étape, 70 à 80 des adultes vaccinés première dose et 25 avec 2 doses. Donc, ça, c'est des bonnes nouvelles. On va sûrement avoir d'autres détails d'ici une semaine. Je suis pas mal sûr avec des normes et des protocoles qui vont avoir beaucoup plus de détails. Donc, avant que je va aux questions, on va aborder au niveau des vaccins parce que les vaccins, c'est ça qui va vraiment accélérer le taux de relax, si vous voulez, au niveau des mesures qu'on a présentement. Je veux juste aborder ici, on va aller en français. Donc, on voit ici qu'on est rendu à 91, presque 92 000. Ça ne compte pas aujourd'hui et demain. Donc, d'ici la fin de semaine, on va être presque à 94, 95. La semaine prochaine, on va aller sûrement plus que 100 000. Donc, ça va bien avec nos vaccins. Je vais vous donner une sommaire ici. Attendez, je vais juste aller en français, excusez-moi. Donc, au niveau de nos vaccins, on voit ici tous les différents endroits qu'on vaccine. Je vais expliquer un petit peu parce que là, on dit 100 100 c'est parce qu'on est basé sur la démographie qu'on avait au census 2017. Donc, ça se peut qu'en effet, sa population a augmenté. Il y a d'autres bureaux de santé qui sont à 103 parce que c'est basé sur les chiffres de 2017 et la population a augmenté à ce moment-là. Mais au niveau des projections qu'on voit avec le ministère, on est rendu, nos chiffres ici sont plus proches à 95-94 qui est très bon aussi. Et vous voyez, avec l'âge, ça diminue, mais on s'attend vraiment que ces chiffres ici vont augmenter de façon importante d'ici le prochain mois. Il faut dire aussi que on continue avec un bon progrès avec nos vaccins. Nous allons, d'ici le fin mai, on a 23 000 places réservées et je pense qu'elles sont toutes remplies. Nous avons ajouté une autre 27 800 places entre le 7 juin et le 26 juin. Donc, à ce moment-là, d'ici le 26 juin, on rajoute 50 800 places pour les vaccins. Ça fait un total, si on peut avoir une projection, on va voir, là, on est rendu à plus que 90 000. Donc, disons qu'on en rajoute 50 000, on va être beaucoup plus que 140 000 et on ne compte pas les pharmacies, tout ça, juste nos pharmacies. Donc, à ce moment-là, rendu au 26 juin, on va avoir vacciné au moins 140 000 personnes. Et si on se base sur les adultes, la population d'adultes chez nous, qui est à peu près 167 000, on est rendu à 83 de la population vaccinée première dose. Et si on compte les enfants, parce qu'on va les vacciner en mois de juin aussi, les enfants de 12 ans à 17 ans en total, on a une population en total plus qu'à peu près 180. Donc, ça représente 78 première dose. Donc, je prévois que on va approcher, on va être capable de commencer les deuxièmes doses de façon plus vite dans notre région. Et ça, c'est des bonnes nouvelles parce que le plus qu'on est rendu aux deuxièmes doses, le plus le pourcentage de deuxième dose, le plus qu'on pourra enlever les mesures. Une fois qu'on ouvre, on va augmenter le numéro de personnes qui pourront se rassembler ensemble, le changement des mandats des masques, etc. Mais ceci va être plutôt plus facile à faire et de façon plus accélérée une fois que nous avons vacciné un bon pourcentage 2 fois dans notre population et on est sur le bon terrain pour ça. So I'm just going to answer some questions that I've had from the media here. Was wondering when new clinics will be booked for 18 plus. Yes, we've added, like I said, today we added, and it's going to be in the system very shortly. We added another, like I said, almost 28,000 places between now and June 26th. So there should be availability for people 18 years and over going into the system. When we add it, sometimes it takes a couple of days for them to add it to the system provincially, but there will be there. Another question from Robert from Steve from Glengarry News. When can splash pads reopen? As a matter of fact, we believe splash pads could be open now because they're part of recreational amenities, playgrounds. And playgrounds, as you know, are allowed during the stay-at-home order. So they are allowed. We've actually notified our municipalities of that. And in any case, they would have been open this weekend. But again, we thought specifically they'd be open anyway because of the fact that they're considered playgrounds and play structures. I have another question here where we had reminder explanation. Oh, yes. There was some questions about the seventh dose. Sometimes we get a seventh dose out of our vials. Pfizer has you can extract. Initially, it was 5 doses in a vial. Now we can get 6, and some people, not only us across Canada, have been getting a 7th dose. And some people think that it's diluted, or it's not. I can explain to you. It's a simple math. The vials themselves have 0.25 cc's of product of the vaccine product itself, and we add 2 cc's, so it's 2.25 cc's. And 6 doses of 0.3 gives you 1.8 cc's, which leaves you 0.45 cc's in the syringe. And they do that because with ordinary needles, ordinary syringes, you lose a bit. So they give that as a buffer. But we're using what's called low dead volume syringes that really don't lose any vaccine in the process of drying up, and so that we're able to gather another dose out of that. Now that is not diluted; that is just extra there. The company keeps it there as a buffer, and it is that amount. So we're comfortable with that. And as I said, we're not the only health unit that does that. Additional dates of clinics. Yes, I've talked about the clinics, and this weekend will be a test of people's will to continue following orders and measures. Should orders be extended to mid-June in order to provide? Yeah. So you know what? This is a good question. It's actually very timely. So I'll read it because it's important. This weekend will be a test of people's will to continue following all of the orders and measures. Its results will only appear within a week or 10 days afterwards, and so which is about the time that the current stay-at-home emergency orders are set to expire. Should the orders be extended to mid-June in order to provide time to see the fallout of what the people are doing this long weekend? Actually, this is precisely why the ministry today announced that the step 1 would be around June 14th. I think it should take that into account. So we'll be taking into account around that time where we are with the numbers, what the tendencies are, and they'll be waiting a bit more in terms of when they will sort of really start that step 1. So actually, it's a very timely question because that's precisely why they wanted to give that other benefit as well, because again, it has to be reevaluated, and that's why they said around June 14th, which is 12 days after the June 2nd expiration. So I see them sort of on a waiting pattern, and that's why they gave those dates. Now, if numbers don't go sour or don't go south in terms of the bad way, I mean, and negatively, obviously they may make it a bit earlier in terms of when step 1 will occur. Jenna, that's it for me. Questions, please.
Thank you, Dr. Paul. Merci. Our first question comes from Bill Kingston, Cornwall Newswatch. Please go ahead.
Good afternoon, Dr. Paul.
Hey, Bill.
Hey, I wanted to ask you the rates of vaccination, the 20, 30, 40, and 50 age group, are you anywhere from about 9% to 25% have received at least 1 dose compared to the older age groups. Can you speak anecdotally about, based on the appointments that you're seeing, are there any concerns about those age groups in the rates in which they are booking appointments compared to the older ages?
I don't have the all of them all the time, but I was seeing patterns. We believe that the discrepancy that you're seeing now is due to the fact that it was only recently that we opened, 50, 40s, and 18s. So this is probably because, and that's reflecting more that. However, we do expect there'll be a bit more hesitancy in the younger age group. So we haven't seen that yet play out, because I have another reason to explain why those numbers are lower. Time will tell over the next couple of weeks where our rates are. Yeah, looking, because we don't get an indication of what the age groups are. We only see them after they come into the clinic.
Okay, so
Okay.
so you didn't see, as far as when you obviously when you opened the 50 and 55 plus around April 30th to May 6th, and then the 40 plus array around May 13th, the first day or two, the number of appointments that you saw that came in compared to like the 80 plus?
Well, no, we didn't, because what happened was we still had some residual 60s. We had quite a lot of 60s. That was the problem. I don't have the numbers here, but I seem to recall when they told us, well, you're going to go to 60 now, we were quite worried, because we had a much bigger population in the 60s than we had in the 70s and 80s. And so we said, oh, we might not have room for the 50s when we went to the 50s. So I think that's what pushed them a bit to the left of that curve. But we're just going to wait and see. I'm confident that we will be seeing the numbers go up. They might not go up to 90%, 95%, but I'm pretty confident that they're going to go up. And overall, it's going to be bringing us up to those numbers, those herd immunity numbers.
Okay. And just finally, so from what I'm hearing, your only worry really is in hesitancy in any group is probably that 20 range, or you don't
20 to 30, something like that. Yeah, that's what we're doing. And we're also looking now at the hesitancy in the youngsters as well. Don't forget, we're vaccinating 12 to 17. So we got about 12,000 of those as well in our area. So we're working now with our school boards to be able to look at ways that we can enhance uptake among that age group. So that's another thing that we want to ensure we're doing.
Okay, thank you very much.
No problem.
Next question, Philip Blanchard, Morrisburg Leader. Please go ahead.
Hi, Dr. Paul. Building off the question that you answered before, Bill Kingston's there, you said about the extension of orders or so on. According to Minister of Health Christine Elliott, she said that the stay-at-home order will end on June 2nd and that the emergency brake would stay in place.
Yeah.
But the emergency brake allows for in-person shopping at grocery stores at 50% and all other retail, including non-essential, at 25%. Yeah. But step one of the new three-step plan has 15% for non-essential retail. So this seems a bit confusing. Can you clarify or explain that?
I can't explain it because I just heard it myself. We're going to have to go back. Tomorrow we have a meeting at the Public Health Measures table. We're going to review that. I have not seen the exact framework that they're referring to. And it wasn't very clear to me what the interim would be, as you were pointing out, between June 2nd and June 14th. So we're going to clarify that. Hopefully I have some clarity tomorrow. But I too questioned that.
Okay, good. I'm glad, because I saw my alarm bells were going off right away there.
Yeah, I know. I think they're going to I think they're going to redefine emergency brake.
That would make sense.
Yeah. Yeah.
Also, at that press conference, Premier Ford said that there was some disagreement with students returning back to in-person learning, citing both some public health officials and some teachers' unions not coming to a consensus on this. Mm-hmm. You're a pediatrician. Do you believe yourself that students should be back in class now before the end of the school year?
Yes. Yes, I do. Okay. I believe that it's safe enough to them to go back. I think they'll benefit from it, even though it's 3 weeks a month or whatever it'll be. I think that they can go back. As a matter of fact, I've been speaking to a lot of my colleagues, and the consensus is that they should go back. So we'll leave it up to the government and see.
Okay. And lastly, you said about 27,000 spots were being added into the system. They're not there yet, because I just checked for one of my own kids.
No, it takes a couple of days.
Yeah.
3 days sometimes.
Yeah. And so with that, you've said about 27,000 spots. Are they just at the big clinics that you have already, and you know what I'm hinting with, anywhere else?
Yeah, we got clinics. Yes. Well, first of all, this excludes, first of all, let me just see. It's the big clinics that we have. I've got the list in front of me here. I can tell you, they include, obviously we're going to go back to Morris. These are mostly the bigger clinics that we have here. However, we are going to be doing clinics back in Embrun, back in Morrisburg, and so on, moving forward. And we're also going to be, like I said, Morrisburg is in there, Embrun is in there. Yeah, so it's the usual sort of areas that we do it at. But we're also going to be increasing our availability of vaccine to our primary care physicians. And as I said before, we're also going to now finally have a good number of pharmacies with vaccine availability, Moderna or Pfizer. So I think with all that, we'll have a pretty good abundancy of vaccine availability and choices.
Okay, and no dates on any of those that you could give?
For what, pharmacies or for?
No, for the clinics like in Morrisburg or elsewhere.
Yeah, I could tell you. I've got it here. We'll add to this, but let me see now. Right now, I got all the dates with them so far. Yeah, Embrun is 17th of June. Morrisburg is 17th of June. And the other ones, again, there are and then we got Embrun the 24th of June and Morrisburg the 24th of June as well.
Okay, great. Thank you very much.
Okay, no problem.
Next question, Thomas Stockton, TVC 22. Please go ahead.
Hi there, Dr. Paul.
Hi, Thomas.
First of all, I just want to touch on a little bit more of the confusion as well. You obviously mentioned that you're going to go back and have a meeting about that interim period, but currently we're allowed groups of 5 people to gather from different households, but there's a stay-at-home order.
I know.
What's happening with that?
The stay-at-home order stays. And that's what the dilemma was when they were contemplating on opening up outdoor amenities. And so what they will consider, and they said that it's a stay-home order unless you have to go out to food, exercise, or those type of things. So they're limiting it to those type of activities, outdoor activities for recreational or exercise purposes, if you notice the trend in those. And I think they had no choice but to add the 5 gatherings because sometimes you can't avoid it in those settings. So the bottom line is, is go outdoors, go local, and stay home as much as you can. But if you're going to go outdoors. And they had to give some kind of otherwise people would be quote unquote breaking the law if they just went out and happened to talk to people in the park.
Yeah, absolutely. Which is why
that was their dilemma. That was something that we were struggling with, trying to say, okay, if they're going to open up the amenities, you can't just say stay at home and don't have any and have no gathering limits as well. So the rationale is that stay at home, go out to exercise, for your mental health and so on. And if you happen to meet people there, you can meet them, be 2 meters apart, but don't congregate more than 5. That's what the bottom line is.
Yeah, well, hopefully there was going to be some wording coming out following that meeting then as well to help people.
Well, yeah, I also do not, like I said, I'm trying to see what will happen in the interim between, like I said, between June 2nd and June 14th.
And well, my second question was, no one's really going to argue the fact that I guess some people would, but like more outdoor amenities, it's great, go outside, make the most of the sunshine in a safe way. But what would you say to obviously the small business owners or even parents who need to buy summer clothes for their kids who are going to have to wait another month before they even get the chance to do that, yet they can watch people go out and enjoy themselves and play golf?
Well, again, we're looking at risks and we're looking at indoor versus outdoor. We know that outdoor is 20 times safer than indoor in terms of that. Retail can open by curbside pickup and delivery, so they can do that. And I do know that they're penalized, but I do know that they'll be allowed to open, by the time. And again, June 14th may be pushed a bit earlier, depending on the number. So I do realize the frustration, but on the other hand, it has to do with indoor versus outdoor. And the science table today showed some compelling data that the indoor risk is 20 times higher than the outdoor risk, and that's why we're trying to start with more emphasis on outdoor activities and then a progressive increase. And as you see, the first step will include retail opening.
Absolutely, yeah, that's fantastic. Thank you, Dr. Paul.
No problem.
Next question, Natasha Wood, Nation Valley News. Please go ahead.
Hi, Dr. Paul.
Hi.
So just to confirm, the outbreak at Farley Windows and Doors, that's over?
No, it's ongoing in Alexandria.
Okay, thank you so much.
No problem.
92.1 FM demande, est-ce possible de répéter le nombre en pourcentage de vaccinations nécessaires pour chaque étape de déconfinement de l'Ontario?
Oui, oui. Pour le... Attendez, je vais chercher ici. Pour la première étape, ça prend 60% des adultes vaccinés une dose. Deuxième étape, 70% des adultes première dose, 20% des adultes deuxième dose. Pour la troisième étape, entre 70 et 80% première dose et 25% minimum deuxième dose.
Merci. Do those joining by phone have questions? Press star 6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Those are all the questions for today, Dr. Paul.
Thank you. Oh, just to remind everybody that our next session usually it's on Monday because it's a holiday. It's going to be on Tuesday. Juste pour n'oubliez pas que le fin de semaine, lundi c'est un jour férié, donc la prochaine conférence de presse va prendre lieu exceptionnellement mardi prochain. Have a good weekend, everyone.